Hi there, my name is Corey Pierce and I'm an Iboga provider answering questions for you. The next question I had is, how do I treat people remotely? Well, depending on what they're being treated for, essentially the process is first I diagnose what they're being treated for. If it's for purpose of giving a flood dose, I would need their body weight. They'd have to confirm, I give them confirm that they're in good enough health and condition to take the Iboga. Essentially, I get their body weight, I calculate their dose based on their body weight. And after I've calculated their dose based on their body weight, I ship them the dose, and then what I do is I provide them information to prepare for taking the Iboga and what to expect. So essentially, I'm essentially like a guide or an advisor, so they have someone who's experienced with the medicine, who knows what to expect, know what kind of outcomes to expect. So I try to help manage outcomes and expectations, and also give them a clear, the most information they can get, and the best information they can get before taking the Iboga to be able to do it safely, practically, and affordably. So this way they can do it at home with friends or family, in the comfort of their own home. I make sure they do it safely so there's no issues or complications with the treatment. And that's essentially my goal, and I try to do it so it's affordable. So I essentially charge $2,000 for a remote dose. If it's for treatment for Parkinson's, the price gets actually lower because then I get the charging by the gram. And with Parkinson's, you can also actually use root bark over a long term. Initially, you have to do some extracts to get started, but then later on, you can follow up with just root bark, which is great in the tea if you can handle the taste. Yeah, so since I do, I just advise and try to get the best practice to be able to take a Iboga in the best, most affordable, effective, and safest way for the best price, so they're not spending thousands of dollars or getting ripped off for some dude in Africa who himself is just trying to make money off of medicine that the Westerners seem to be using and not them. Anyways, I won't get too political, but that's essentially what I do.